One, two. One, two. Oh, there we go. Finally, that technical difficulty is sorted out. So, a very, very warm welcome to you as South Africa and those who's watching and waiting. Yes, it's Project CB. My name is Carlet, and we just had a little bit of a technical thing going on here, but we're back on air, and I would love to hear from you. What would you love to hear from our president? He's speaking at 8 o'clock, and it's interesting. Maybe he's going to give us good news or bad news. What would you love to hear from our president tonight? So give us a comment below in the YouTube channel. I would love to hear your views and your takes on that. And if you are doing it from Facebook, listening to Facebook, you're more than welcome to leave a comment on our Facebook page as well. So what would you love to hear from our president tonight? Yet again, they've got these theories saying that our president, if he's got a red tie on, it's bad news. And if he's got a blue or whatever tie on, it's good news. So I don't know. What would you love to hear from our president tonight? So please do subscribe to our YouTube channel. It is Project CB. You are tuned into Project CB. We are covering tonight the nation address, and I'm a little bit nervous. I'm really, really nervous about this because I don't even know what the president is going to give us and speak to us. It's nerve-wracking, all right? But what would you love to hear from the president? Give us a comment below. I would love to see your comments, and I'll definitely give you a shout out as well. So you are tuned into a Project CB. If you just tuned in, a very warm and welcome. We all are waiting for our president to speak. It is a little bit nerve-wracking. So there's a comment that you can just say, yes, we here, we are watching, we're all waiting. This family meeting was just quick. It was like a quick one, and there we go. So please do subscribe to Project CB if you are on our Facebook. Please leave a comment there. If you on our YouTube, a very warm and welcome. Please, what would you love to hear from our president tonight? I'm a nervous wreck because I don't know what. To be honest, I'm not too sure what I would love to hear from our president tonight. But please, maybe you would love to give us a little bit of input and say, okay, Khaled, this is what I want, this is what I don't want. Maybe we are moving to level 2. Send your comments, comment below in the commentary box. On Facebook and on YouTube, please subscribe to this channel. It will make my day as well. So, but thank you for those who are tuned in to Project CB. Now, let me quickly give you 5 important things according to Business Tech that was happening on Friday, because on during the weekend there's not much happening, but business is business from Monday to Friday. So on the topic of Business Tech, it says coronavirus, the heading there, coronavirus. So yeah, maybe we need to make something else like violet. It just sounds like a flower then, and not like a deadly virus. But anyhow, the Business Tech says that the global COVID-19 infections have hit 113.5 million confirmed cases, with the death toll reaching 2.52 million. So in South Africa, there have been 1,676 new cases, taking the total reported cases to 1,500,000 and a few other digits as well. But if we round it off, it's 1,510,000. So the death have reached almost 50,000 daily, and it increased with 144, while the recoveries have climbed to if around it all figures, there's 1.5 million, leaving the country with a balance of 35,000 active cases. Now, and listen to this, the vaccine is on our lips every day. We want to be vaccinated and we don't want to be vaccinated. There's an opinion, so, but give me your opinion quickly. Will you be one of those who will be vaccinated? Yes? Or would you be those that says, no, not now, I'm not going to take the vaccine? So quickly give us your answers there in the commentary box, please. I would love to hear from you. And if you're on Facebook and you're listening, tell me. Give me your comments. Tell me, yes, Scarlett, I will be vaccinated or not. But the amount of people that have been vaccinated already is 52,647. All right, that's quite a lot. And I think our president is going to speak about this cases as well. So let's be honest. Would you be vaccinated? Will you go there? Will you say yes, no? Or maybe, I'm still in the in-between phases of, will I be one of those that wants to be vaccinated or not? But give us your comments and tell me if you would go that route or not. So for me, like I say, I'm in that in-between phase, not knowing, maybe yes, maybe no. I'm not too sure just yet, but maybe if there's more test trials that's coming out, maybe then we would be more comfortable doing that. But let me get your take on that as well. But you're listening to, and you are tuned into Project CB with myself, Carlette, and please do subscribe as we are waiting for the nation address with our President Cyril Ramaphosa. It is a family meeting yet again, and it's quite nerve-wracking. So it was quite a quick one. Us as journalists just got the news, and wham bam, here we are, and we're waiting. But I really, really hope that he's got good news for us. So if you are tuned into Project CB on the YouTube channel, please leave a comment. I would love to hear who's tuned in, who's with us on this family meeting. So don't be afraid. Just say hi. If you're on our Facebook, please leave a message there, like it, do whatever you need to do. But I would love to hear you guys as well. So what happened? There's another thing. There's 5 important things from the Business Tech that I would love to share with you while we are waiting for our president to speak. And this is what Business Tech says, is that the heading there says it's here to stay, and that's a frightening way to think about it. That the COVID-19 is here to stay. I mean, we're all a little bit tired of this COVID-19, but the health experts warn us that people need to face reality and start coming to terms with the fact that COVID-19 is not going to go away, and that vaccines will not be the silver bullet. So, what would you like? What would you do? Would you go for that vaccination or not? I mean, here we hear again on Business Tech that it's here to stay. COVID is here to stay. I'm not too happy with that, but you know what? Maybe we need to just get to terms with this. But if you are tuned into Project CB, please hit that subscribe button as we are waiting for the president. We've got about 12 minutes to go to our family meeting. I know that this was a quick one, and it's scary because we don't even know what the president is going to speak about. And I would love to hear what is he going to do as well. So from this side of the fence, what would you love to hear from our president? What would you say? Yes, Scarlett, I would love to hear the following. Last month we had the liquor that we got the liquor back from, and our curfew changed. So what is this? What is next? Will we go to level 2? They are speaking about a third wave. It's just crazy. So what would it be? We've got about 11 minutes to go. Then our president's going to speak to us. You are tuned into Project CB. We are waiting for the president to address the nation and the developments in the COVID-19 response. So please, what would you like to hear from our president? Give us your ideas, your thoughts. Put it in the commentary box on Facebook. I would love to hear what is your thoughts and ideas on that as well. While we are waiting, let's keep each other a little bit busy as we are waiting for the president to speak. Let's get to another point with the business deck. So I think we are having enough. So they said that other citizen groups has had enough of the local municipality failing to deliver services. Now, come now, let's talk business here. How many of your municipality is failing? You can be right over South Africa, and here in Meyerton, I want to give the Meyerton municipality a thumbs up and say, you guys are doing a great job, but what are your take on it? What would be your local municipality? Are they failing you or are they serving you? That's quite a big thing right now, is that the corruption is here, and Mr. President is helping to fight that. But it's like a tender thing, you know, it's hard. It's not that easy, but you need to tell us. Is your municipality failing you, or are you getting there? So I think our municipality is getting it right. So I thank you for them. They are doing a great job. So if you guys are listening, we in Meyerton, a nice little town just south of Joburg. It's a beautiful town. Everything is working. So thumbs up to our municipality. And there's some municipalities that's not working at all. But that's a story for another day. Now there's Big Brother. Yes, Big Brother is watching our every move. You remember that Orwell 19 84. Yeah, that's George Orwell's book, 1984. Big Brother is always watching. So the State of Security Agency says it is no longer using bulk surveillance methods following the Constitutional Court ruling overtaking key aspects of government at the RICA surveillance law. The act failed to have vital safeguards in place to notify people when they had been under surveillance, lacked ways to prevent collected data from being used unlawfully, and had no confidentiality protection in place. And that's putting legal clients, whistleblowers, or other journalist sources at risk. So that is from the Daily Mervik. That's quite a good side and a good place to be as well. So you are tuned into Project CB. There's about 7 minutes to go until our president speaks. I can't wait till he speaks. So I'm not too sure what he is going to speak about. So please help me. Try to tell me, what would you love to hear our president to speak? What would you want to hear and what don't you want to hear? I know that the churches would really love to hear that they can open at 50% capacity, but yet again we are talking about the third wave that's coming. It's a little bit of a catch-22. What is going to happen? Who is going to do what is... It's just one of those things. So hopefully we will get answers from our president tonight. So please hit that subscription or subscribe to Project CB. I'm just entertaining you a little bit until we have our nation address. It's quite one of those things that we need to remember, that we all in this. And yes, we've got Dennis. Hi, Dennis. I hope that you are keeping well. Thank you so much for your comments. Thank you for tuning into Project CB. We are covering the news from our sister station ENCA. It's the same, but I'm here to entertain you for just 5 more minutes until we have this nation address. So, Dennis, I hope that you are keeping well today and that you are not so nervous as I am concerning this nation address. So, yeah, what would you like to hear from our president? But before we get into that, yes, Big Brother is indeed watching us, and then we've got the markets. We need to speak money quickly here. But that's now a little bit behind us, though. That on Thursday was a tough day for the local currency, and it tested the 14.18 to the dollar. But that was on Thursday. But let's quickly check, what is the dollar? I think it is like 15 rand or something to the rand. It's 15 rand and 12 cents. That's it's good. It's, if you've got a little bit of dollars, you are making money. We know that we want to get our dollar down. So it's always one of those things. We want more money, but we need our economy to be better. So that was more about things that happened on Friday, as we are just waiting for the president to speak. So please do subscribe to this channel. It's Project CB. My name is Carlet, and we are going to watch this together today. And it was a quick nation address to the nation. We just had a quick wham bam, here we go. And here we are, all sitting and waiting for our president to speak. So our president is speaking, and we need to know what's going on. So let's quickly get to Facebook. What is happening there on Facebook? Okay, there's no comments there just yet, but on our YouTube, please do subscribe. That is our main source of broadcasting right here on Project CB. My name is Carlette, and a very warm and welcome. If you've just tuned in, we are waiting patiently for our president to address us, and I'm not too sure what he is going to say to us. But what would you love to hear as the comments? If you like, whenever you want to share a comment, share it while the president is speaking. And if you like a certain aspect, just pop your comments there. Please do subscribe to Project CB. I would love to just be with you. Because we as South Africans, we are family, isn't it? And we need to help each other out. So in 2 minutes, we are counting off the minutes until our president is speaking to us. It's quite nerve-wracking. I'm not too sure what he's going to speak about. He's probably going to get the vaccine going as well. Tell us more about what happened with the Pfizer and the Johnson and Johnson. The Johnson and Johnson vaccine seems to work now, and yes, so we are waiting. We are definitely waiting for our president to speak, and I would love to hear a little bit of good news. I think it's time for us to get some good news, and not bad news saying, oh no, we still stay at level 1. But that's just me. So please get yourself on to subscribe to Project CB as we are waiting. It's almost time for our president to speak, and it's nerve-wracking. I'm telling you. It's one of those things that I'm thinking, we need to get some good news going. So I would really love to see good news. And as you can see now, we are going to cover it from our ENCA. So we're going to cover it from the ENCA news broadcast as well. So don't go anywhere. Get yourself some popcorn because tonight is going to be a very interesting evening as we are waiting for our president to speak. It's nerve-wracking. I'm telling you, it's nerve-wracking. So I don't know. I don't know what he's going to say and what does he want to say to us tonight, but it's in a few minutes, then we will definitely hear what our president is going to say. I hope that he's not going to be late, though. That's just bad manners. But so I hope that we will have good news. And before we get into our president's address to the nation, please hit the subscribe button. I would love to have a little bit more of you, and so, yeah, or just give us a comment like Dennis. Thank you so much yet again for Dennis. Just say hello. I'm watching. We all good to go in a moment in time. It's like I say, it's crazy. But let us hope that our president's got a good news for us. I believe that he's going to have good news. Well, that's what I want to believe. Hopefully he will get some, no bad news. If there's bad news, I don't know. What can we do when there's bad news? I'm not too even sure what we will do if we get bad news. But we'll definitely not going to level 4 or 5. I think we'll probably stay at level 3 and waiting for the third or fourth or whatever wave to come our way. So, please tell me, what would you love to hear while we are waiting for a president? I think it is 8 o'clock. It's 1 minute past 8. We are waiting for our family meeting, and are you ready? Oh, yes, Rayleigh. She's saying yes, there should be good news. Yeah, we all do pray for good news. And nice hearing from you again, Rayleigh. It's nice seeing some friends as well. And I consider everyone here as friends. So, fingers crossed, let us pray. No bad news. We just want good news. But there's this theory of there is ties yet again. Last month he had a different tie on, not a red one. So the theory goes, if it's red, we in trouble. So let's see what we've got here tonight. But we are waiting for our president. So if you are tuned into our YouTube channel, please do subscribe. Please leave a message as we are waiting. And here we go. Our president is live.
My fellow South Africans, this coming Friday will mark exactly 1 year since the first case of coronavirus was reported in our country. Since then, more than 1.5 million people in South Africa have been infected, and nearly 50,000 of our people have been reported to have died from the disease. So much has changed in our country and in our lives. But the spirit of our people has not changed. You have endured the greatest hardships, but you have remained resolute, united, and hopeful. Now, a year after the virus first reached our shores, we have a much clearer path towards containing infections and ultimately overcoming the disease. Within less than a year, the global scientific community has been able to develop, it has also tested and produced several vaccines that are safe and effective against the disease. This was not foreseen in the past. South Africa's scientists and research institutions have made an important contribution to these efforts and have contributed to global knowledge about the disease, including on the emergence of new variants. And in this regard, our scientists, who we should be proud of, have really led the way, and they are recognized globally. We have long held the view that a vaccine would be our most decisive measure to combat COVID-19, and to that extent, we've set up processes at a continental and national level to prepare for the availability of an effective vaccine. Like many other countries, we have now started our vaccine program. In the 10 days since we launched our coronavirus vaccination program, more than 67,000 health workers who are on the front line of our fight against COVID-19 have been vaccinated. A new batch of 80,000 doses of the Johnson & Johnson vaccine arrived in the country yesterday, and we are steadily increasing the number of doses that have to be administered each day. The start of our vaccination campaign has so far gone extremely well. It has shown that we can achieve much when we work together as a government, the scientific community, the private sector, and community-based organizations. All provinces have established vaccination sites and have put in place plans for the expansion of the program as it will be gaining momentum. The number of sites that will be available for vaccination will be expanded next week from 17 to 49 sites. Of the 49 sites, 32 will be at public hospitals and 17 sites in the private hospital sector. This includes sites in the rural areas to improve access to rural healthcare workers. Once the vaccination of healthcare workers has been completed, we will begin with phase 2 of the vaccination rollout in late April to early May. Phase 2 will include the elderly, essential workers, persons living or working in institutional settings, and those with comorbidities. For this phase, we will be activating many more sites for vaccination in the public and private sector healthcare sector so that we can reach as many of our people in the shortest possible time. We have recently signed an agreement with Johnson & Johnson to secure 11 million doses. Of these doses, 2.8 million doses will be delivered in the second quarter and the rest spread throughout the year. We've also secured 20 million doses from Pfizer, which will be delivered from the second quarter. Additionally, we have secured 12 million vaccine doses from the COVAX facility, and we are in the process of finalizing our dose allocation from the African Union. We are in constant contact with various other vaccine manufacturers to ensure that we have the necessary quantities of vaccines when we need them. So from a vaccine availability point of view, I'd like to say that we will be secured. When I last addressed the nation at the beginning of this month, the country had passed the peak of the second wave of coronavirus infections. Driven by a new variant of the virus, the second wave was far more devastating and caused greater loss of life than the first wave. The country has now clearly emerged from the second wave. New infections, admissions to hospitals, and deaths have fallen significantly and continue to decline steadily. In the week that has just passed, the country recorded just under 10,000 new infections. A month ago, in the last week of January, the country recorded over 40,000 new cases. And a month before that, in the last week of December, the country recorded close on to 90,000 new cases. Now, this dramatic decline in cases over 8 weeks is due to a combination of a number of factors. The public health measures that we introduced, changes in the behavior and accumulating immunity in those who became infected in our communities. We were able to emerge from the second wave because most people adhered to the tighter restrictions and observed the basic health protocols, including wearing of masks in public and social distancing. The measures we had put in place in December were necessary to contain infections and to prevent our health facilities from being overwhelmed. They were necessary to save lives. We had to undertake these measures, knowing that they placed restrictions on the daily lives of everyone in our communities. We also know that they caused a great deal of inconvenience to our people. And while we made every effort to keep the economy open, we also knew that there were parts of the economy that would be affected and that would not be able to operate fully. Our approach has always been that much restrictions should not remain in place longer than is absolutely necessary to contain the disease. Due to the decline in infections, the country can now ease some of the restrictions on movement and on activity. Once again, we do so very cautiously. Even after a sustained period of relatively low transmission, we have seen how the number of new infections can rise rapidly and without warning. Based on an assessment of the current state of the pandemic in the country, Cabinet, after various levels of consultation with our provinces and our metro mayors, Cabinet has decided earlier today to move the country from coronavirus alert level 3 to alert level 1. The new alert level will come into effect later this evening once the regulations have been gazetted. This will mean that the hours of curfew will now move from 12 midnight to 4 a.m. Second part is that gatherings will be permitted, subject to limitations on size, adherence to social distancing and other health protocols. And these gatherings will include these following types of gatherings: religious, social, political, and cultural gatherings. The other part is that the maximum number of people allowed at any gathering is 100 people for indoor gatherings and 250 people for outdoor gatherings. Where the venue is too small to accommodate these numbers with appropriate social distancing, then no more than 50% of the capacity of the venue may be used. Night vigils or other gatherings before or after funerals are still not permitted. Nightclubs will remain closed. The sale of alcohol will be permitted according to normal license provisions. However, no alcohol may be sold during the hours of curfew. The wearing of masks in public places is still mandatory, in other words, compulsory. And failure to wear a mask when required to do so remains a criminal offense. The 33 land border posts that have been closed throughout this period will remain closed, while the other 20 will remain open. Only 5 airports will be open for international travel with standard infection control measures in place. And these are OR Tambo International, Cape Town International, King Shaka International, Kruger, Mpumalanga, and Lanseria Airport. As we ease restrictions, we cannot let our guard down. The few remaining restrictions under level 1 are meant to maintain low levels of infections and in particular to prevent super spreading events. The new variant known as 501Y.V2 is now the dominant variant in the country. Because the new variant is transmitted more easily, it has the potential to infect more people, and it places a greater strain on our health system and lead to greater loss of life. Therefore, social distancing is even more critical. Wearing a mask and avoiding crowds is even more important. And it is now even more important that we all download the COVID Alerts SA mobile app onto our cell phones. Nearly 2 million South Africans are already using the COVID Alerts SA mobile app to be notified if they are exposed to the virus. And we continue advising people to go for a test if you have any symptoms of COVID-19. These measures are not merely to protect each of us, but also to protect those who we love and we care for. Following these measures is about protecting yourself, your family, and your community. It is about being responsible and caring. We must continue these measures even as more and more of our people get vaccinated. Vaccines significantly reduce the likelihood of a person developing symptoms and becoming seriously ill, and they reduce the overall rate of infection in a population. We therefore need to see vaccines as one of the measures that we have in our coronavirus toolkit to contain the pandemic. As we have said in the past, vaccines are now the most effective measures that we have. Still, we will only be able to ultimately overcome the pandemic if we continue to practice all other prevention measures as well. We must do all this both so that we defeat the pandemic and so that we can accelerate our economic recovery. We must do this to restore our country to growth and to get people back to work. Even as economic activity returns, even as we roll out our employment stimulus and infrastructure investment programs, even as we undertake economic reforms with greater urgency, many businesses are still struggling. Many people still do not have their jobs back, and many households are still feeling the effect of having lost much of their income. As I announced in the State of the Nation address, we have therefore extended the period for the special COVID-19 grant by a further 3 months until the end of April. We have also extended the UIF special COVID-19 wage support benefit until the 15th of March 2021 for those sectors of the economy that have not been able to operate over this period. These measures have been shown to be effective at reducing the economic impact of the pandemic on some of the most vulnerable in our society. Our country's public finances are, however, extremely constrained, and we cannot keep such relief measures in place indefinitely, much as we would have wanted to. The return to alert level 1 means that most of the remaining restrictions on economic activity have been removed. We expect this to lead to higher consumption spending, bolstered by the steady recovery in employment. We expect businesses to implement the plans they have put on hold due to the restrictions. As we undertake further structural reforms, this will entrench the green shoots we have begun to see in the economy to come through. That is why all our energy and effort must now go into growing the economy, and this includes keeping infections down. For this reason, amongst others, the easing of restrictions should not be viewed as a reason to abandon the precautions that we need to take to combat coronavirus. The threat of a third wave is constantly present, as is the threat of yet new variants of the virus. As we witnessed last year, our actions as individuals and as a collective will determine whether and how soon we experience a resurgence of the virus. In the meantime, the virus continues to circulate in our families, our workplaces, and our communities. As our vaccination campaign gathers momentum and pace, we must continue to exercise extreme caution to protect ourselves and others. Together with our scientists and experts, we will continue to monitor the situation closely and to adapt our approach in a responsive and flexible manner. And we will, together with our scientists, continue to build models so that we can anticipate what further infection rates could be like. This pandemic has taken much from us, but it has also taken a lot from us, but it has not taken our strength away. Our courage has not been dampened, and our sense of solidarity as a people is still strong. It has also not dampened our spirit or weakened our resolve as a nation. Our unlikely and uniquely South African spirit has allowed us to remain steadfast in the face of an unprecedented threat. And this threat is a threat that we have met as a nation, and we have been able to inspire each other and to chart a path to recovery. And I would say that we should remain united. We should also remain hopeful, but we should also be determined as ever to face down this challenge that has confronted our nation. And as always, I want to end by saying we wish that God continues to bless our beautiful country and its people. And I thank you all. And I thank you because we have worked together to achieve the progress that we have. Thank you to all of you South Africans.
Well, that was our president just saying thank you. Oh, shoo. It is definitely good news. We have good news. So thank you so much for tuning into Project CB. I am Carlet Badenhorst. Please do subscribe to our YouTube channel. Hit that subscribe button. And there was quite a lot of questions that's coming from this. But level 1, I haven't even foreseen level 1. Oh my goodness, this is great news. Thank you so much, Mr. President, for great news. So from my side, it's always nice hearing from you and keeping well. So thank you so much for listening and tuning into Project CB. It's great knowing that there was quite nice feedback from you guys. So thank you for that. Please, before you go, just hit that subscribe button. And this is actually awesome, knowing that we've got good news that waited for us. This is great. So if you are a religious place, we can do church again. So that's quite good news. Private places, you can do 50% capacity or 100 people. It all depends on, and sometimes these things are a little bit 50 from this and 50 from that. So it's quite interesting. But thank you so much for tuning in. We have good news. We can celebrate now. And please let us, if you have something to say, Facebook, YouTube, just pop a message in quickly. Thank you so much for tuning into Project CB. I am Carlet, and I will definitely see you guys soon. We will chat. Thank you so much for everything. Thank you for the family meeting. Until we meet up again,